And we're live again.
Yes, we are. Hi.
I'm Allison Johnson, Manager of Communications here at Windsor Regional Hospital, back again with my friend Monica.
Hi, I'm Monica Staley-Liang, Regional Vice President of Erie St. Clair Cancer Program.
And we welcome you to join us tonight. Pull up a chair, get comfortable. We have some news that we're pretty excited about.
Very excited about.
You ready?
Ready.
Tonight we are launching,
Ta-da!
ta-da! This is Canswers Center Live. So this is a new webcast that we're starting tonight, and it will be broadcast the third Wednesday of every month, but not in December. We're going to do it a few extra times just to get used to this. What it is, it's an interactive live discussion with you. We've got lots of great people here at the Cancer Center. We've got lots of friends in the community, and we really want to open up a discussion that isn't happening right now. And we've got this new tool in the toolbox that we discovered yesterday.
Well, it was really great. In September, we had what we called our team had a retreat. But I don't really like that name, retreat. We're going to call it summit, something energetic, because the commitment, passion, and energy that day, talking about emotional support, was palpable. Everybody was energized because our patient satisfaction surveys are really good regarding treatment. But when we talk about patients' emotional support, we're not doing so well. And everybody's really unhappy about that because we want to be there for people. We have an awesome team. But a lot of our patients' questions, their concerns, and specific to them, that they need to relate to someone who's experienced their journey, are not being answered. So this idea stemmed from there.
And it's tough. We realize that to get all of your questions answered during a doctor's appointment or while you're here, because for many different reasons, you may have a lot of questions. Some things may not come up. Some things you might not be comfortable discussing, right?
So absolutely. You know, when I was a patient representative and I used to hear and help people navigate through the system, many of those concerns are personal or emotional, or they feel they feel embarrassed to ask their doctor. We're really lucky here because part of our team, though we have amazing doctors, nurses, social workers, dietitians, we also have an amazing PFAC, which is our Patient Family Advisory Council. And they're part of the creation of this toolbox. And so they're here and they've been through the journey and can relate to what you're feeling and maybe be able to just have a talk, have a chat in the comfort of your own living room.
With patients who know what you're going through. We are going to have different topics and different guests every month, and they're always going to be one patient here, so that you can ask these questions to somebody who's been there, somebody who can say, you know what, yeah, that happened to me, and it's going to get better, or you know what, that sucks, and I get that, and you're right, it's awful, but they know what you're going through, and you'll know that you're not alone. And Monica, you see all those little thumbs up going across here. That means that people are watching this right now.
See,
and people
we're so happy.
And that's what we want to do. We tested out this equipment yesterday.
Just a test.
Just to make sure that this worked.
Very spontaneous.
We went live, and
we had over 3,000 views.
3,000 views.
3,000 views.
Somebody's commenting to us right now. Congratulations. This is your most commented on live video.
Oh, thank you.
Well, that might have been Facebook.
You know, we're very happy to have Allison here. I'm very proud to be part of this with Allison because she comes with a strong journalistic background. So tell us where you come from, Allison, and why you're so excited about this.
So I worked at CBC News for 14 years, and I joined Windsor Regional Hospital about 3 years ago. But I was telling Monica yesterday, when I was at CBC News for about 10 of those 14 years, we were always, every day, I wish we could go live. I wish we could go live. We didn't have that live capability to bring stories live. And then all of a sudden, here comes the internet, starts breaking down walls, and all of a sudden, a live truck back then would have cost tens of thousands of dollars, hundreds of thousands. We're coming to you tonight, and this is free.
Free.
So why not? Why not start this discussion, talk to people out there?
Free, but so important. And I just think I'm so happy to be part of this. It's so exciting so that you can feel that there is a form, a place where you can connect with our team, that you get to know us, that you can trust. We do get asked, well, how about people who don't use the internet? And you're absolutely right. But this is not the only tool in our toolbox. And we'll be able to provide information about other supports that we have in place here at the Cancer Program. But most importantly, we did our research, and we know that 87% of people use the internet. And 72% of those adults have once in their time have looked to ask questions about their health and specific to disease or diagnostics.
And you know that you can't always trust that information that's out there. You Google that, and what comes up, it's all over the map, right? So
right,
now you know,
absolutely.
at least you know who you're asking here.
Exactly. It's local people. It's people who are here, part of the team trying to care for you, and part of patients and families within our area that have been through that experience and can give you tips and advice. It's a time to connect, to feel comfort, to get the answers that you need.
And I hope that that just answers the question that Diane Marley asked about what about people who don't have access? And I think that's a great question. But again, like Monica said, yesterday we were live for maybe 30 seconds?
30 seconds at the most.
3,000 people saw that video, and my mom and husband only account for 2,000 of that. So.
And then mine, the other 1,000. But that aside, this is important. We know it's important.
And if we can get to 3,000 or 300 people that otherwise didn't have that opportunity to ask questions, then I think that that's really important. And I'm excited that we're trying this. Again, it's all about you, though, so I hope that you're excited, and I hope that you'll continue to post these questions. I think that this is going to be an exciting journey.
I do too. We really look forward to seeing you, to hearing from you, to listen to what your questions are, to discuss your concerns, and I'm excited to start this adventure with you, Alison.
Thanks, Monica. And the adventure starts next week, actually. Next week we'll have our first full Cancer Center live broadcast coming.
And what are we
to
talking
here.
about?
Next week's topic is called I Have Cancer, Now What? And we've got two great guests lined up. One is Martha Marks. She's the vice chair of our Patient and Family Advisory Council, and also Colleen Riem, a director here in the Cancer Center. So the two of them, we were talking yesterday, and they were just talking about, well, number one, what goes through your mind when you hear you have cancer, and all of the questions that just come flooding in. And I was talking to Martha, and I said, well, what do you wish that you knew then that you know now that you can share? And she said, not going to tell you now. Come back next Wednesday for the answer to that. But lots of those type of questions, and just, you know, how do I prepare for my first appointment with an oncologist? What do I tell my family? Those kind of questions, you know, we're going to do our best to bring you those answers, and anything that you can come up with as well. So in the meantime, if you have any questions, if you have any show topics, you can, of course, reach us here on Facebook, but we also have an email. It's Cancers Center Live, and Cancers, as you can see here, it's C Answers Center. Our email is cancercenter@wrh.on.ca, and I'll post that later on Facebook so that you have that in advance. You can ask your questions in advance for next week, or again, you can ask them live. I'm going to pull up my cheat sheet and make sure we covered everything.
I think we have. We're pretty talkative, aren't we?
I think we are. This is really fun. A really good outlet. Thanks, everybody, for listening.
And we'll see you next week.
Bye-bye.
Bye.